Video's topic is clinical correlation of mammary gland. Breast cancer. It's one of the most common cancers in females, arises from epithelial cells of ducts. 60% occur in upper lateral quadrant, usually 40 to 60 years of age. Presence as painless hard lump, fixed immobile breast, retraction of skin, retraction of nipple, pudy orange appearance. Spreads mainly by lymphatic vessels to regional lymph nodes. Radical mastectomy is removal of whole breast with axillary lymph nodes, pectoralis major and minor muscles. Mammography is low energy X-ray technique used to detect and diagnose breast cancer. Krukenberg's tumor, secondary ovarian tumor that originates from metastasized cancer cells, typically from breast which spread to ovaries. Developmental anomalies of breast. Polythelia, athelia, retracted nipple, polymastia, amastia, gynecomastia.